Which cats can we return? I'm Dr. Erin Katribe, and as Director of National Veterinary Programs for Best Friends, I get asked this question a lot. So today, let's dive into eligibility considerations for community cats as part of return to field and trap neuter return programs. Let's try to answer this question. Which cats can we return? So first, if you've not heard of it before, I'd like to introduce you to the concept of the feline superhighway, courtesy of our friends at the University of Florida and UC Davis. And so there's a QR code to learn more about this concept. The idea here is that for cats coming into our shelters as a stray intake, the default pathway for adult cats, their superhighway, should be returned to their home. And most often, that means their community home. This means if they were caught outdoors, let's spay neuter them, vaccinate them, ear tip them, and put them back. For kittens, particularly ones that are social, or if they're very young, their default pathway will likely be adoption, maybe with some steps in between, particularly for those neonates. But for the moment, let's focus really on those adults and sometimes older kittens here. Their default pathway is going to be return to their community home. And so let's talk more about this. What are our eligibility criteria for return? Well, let's talk about what does not impact eligibility. And for these adult cats, socialization status does not keep them from being returned. We return even friendly cats. Could they potentially be put on an adoption pathway and get adopted? Sure. But I'll say it again, even for friendly cats, return should be their default pathway. Unless they give me a specific reason not to return them, then that's what they're going to be slated for. Variable eligibility, so young cats, so kittens. The actual age that shelters use can vary, and it can also vary based on behavior. So if we have a kitten that's maybe past its socialization window that truly seems unsocialized, we might elect to release that kitten, particularly if we've identified a caregiver, and certainly if they're old enough to survive on their own. And then medical conditions. We'll talk a little bit more about that, but medical conditions can certainly, make eligibility variable. Who can't we return? So certainly kittens that are too young to survive on their own. If we don't have a location, or if the location that we have documented is known to be unsafe. So say it's by a really busy intersection, for example. And then of course, remember, we're talking about stray and take cats usually. So owner surrendered cats, these cats can't be returned. Okay, so I think it's important to take a step back and think about why community cat programs, because this will put everything into context as to why we recommend return as the default pathway for these adult cats, why we want to reserve our adoption outcomes for the cats that really need those adoption outcomes, and for everyone else, everyone that's possibly eligible, we want to put those cats back out. So why CCPs? First is going to be the state of feline life saving. The reality is we don't have enough adoption outcomes for all the cats that are coming into our shelters. And CCP's return, this is a way for cats to make it out alive instead of out the back door in a black bag. Cats are dying in shelters. And we just don't, like I said, we don't have enough of those adoption outcomes. Lost cats don't make it back home via shelters. Return to owner rates nationally are in the 2% range, so low single digits. And of course, this can vary shelter to shelter, but even for cats that get out of their indoor environment that or that run away from home, the reality is they don't make it back if they go to a shelter. For cats that get away from home and that are found again, that get back to their families, they are 13 times more likely to get home via means other than the shelter. If the most common means, but the way this happens is that they're found by their family searching the neighborhood, or they return on their own. And the reality is, if we keep them at the shelter, this can't happen. This can't happen if we pick them up and take them there. And by and large, the reality is for many, many, many of these cats, the community actually is their home. One thing that we say is they're friendly for a reason. And so when I encounter staff that are concerned about releasing friendly cats, the reality is these cats, like, they're friendly because they have people that care about them. They are friendly for a reason. They have owners. They have families, maybe multiple families for each individual cat, right? But they are friendly for a reason. Okay, so let's spend a second on these cats. The ones that are free roaming, but that I would argue these cats actually do have a home. This is another reason for CCPs. So this is a photo of Star and Myra. Myra has cared for Star for over 10 years. Star got scooped up by somebody trying to do the right thing, and so Star ended up at the local shelter. Now, Star could have lost her life, or at the very least, she would have been lost to Myra forever. But because just a few months before this happened, that shelter implemented a community cat program, including a return to field program. And so Star was sterilized and she was returned back to her community by a shelter staff member. The day that that happened, the day that that staff member took Star back to the community, Myra came rushing out of her house and she burst into tears when Star was returned back to her. And this is them getting reunited. She thought Star had been missing for a few days and she thought that Star was lost to her forever. And so Star actually had a home and it was free roaming in her community with people that cared about her. Star was friendly for a reason, and it was because of Myra. And so this is the common scenario that that we encounter in shelters when cats like Star come into the shelter. Staff say, but we could. This is a friendly cat. We could get this cat adopted. And there are two things that I say to this. Could this cat get adopted? Sure. But when we're overflowing with cats, should we keep those adoption opportunities for cats that don't have return as an outcome option? And for those of you that may not be full right now, you either will be in a few months, or there are likely other shelters that you can transfer cats in from that are full of cats, either locally or potentially distant. And number two, this cat probably already has a home in the community with people that love him or her. This may even be somebody's indoor cat that got out, but statistically, that cat is unlikely to get home if they stay at the shelter. So let's put them back closer to home where they actually will be found by their families. If you still have questions, if you still have concerns about releasing friendly cats, I encourage you to check out these resources that we have. So The Dilemma of the Friendly Outdoor Cat and Not All Cats Who Wander Are Lost. When it comes to medical conditions, who can we return? So let's talk more about that. So first, let's talk about cats with ringworm. So the reality is ringworm is a skin infection, and in cats, it's actually self-limiting. The vast majority of cats will heal their ringworm. They'll kick that infection on their own. And so if we have cats coming into the shelter that are otherwise eligible for return to field, we can return those cats with ringworm. What about dental disease? For me, this one, I take a look at the whole picture. So what does the whole cat look like? If this is an otherwise healthy cat in good body condition, but with significant dental disease, even severe dental disease, if that cat is otherwise doing okay, I return that cat. The reality is most shelters don't have the resources to address even the cats that don't have return as an outcome option for severe dental disease. And so for me, this is looking at the whole cat. If this cat is thriving, it's thriving despite its dental disease. And so let's put that cat back out. Upper respiratory tract disease. What about cats with URI? And the reality is this is a disease of stress. This is a disease that we make worse by holding cats in the shelter. So if I have cats that are showing signs of respiratory disease either on intake or shortly after intake, I know that the shelter is the primary reason that they have this disease. And so the best thing that I can do for them, the thing that's actually going to make them healthy again, is to get them out of the shelter. So I prioritize the cats with URI, get them into surgery, and get them back out, get into their communities and out of the shelter. Wounds, so certainly we can manage wounds at the time of surgery, maybe with primary closure through that surgical management, or we can administer a long-acting antibiotic and then get those cats out. Cats are phenomenal at healing, and they will heal most wounds on their own. Last one I have on here is enucleations. So if we have an eye that is painful, is no longer functional, is causing that cat problems, I just go ahead and remove that eye at the time of their spay or neuter surgery, and then we can release those cats the next day. Who might not be eligible? So some variability here. Let's talk through a few of these conditions where we may want to talk about socialization status, and we might want to consider other options if there are some. So certainly emergencies, urgent care that's outside of the scope of what we can manage at our clinic. Cats that are not thriving, right? So if we do have that cat that comes in with severe dental disease that may have something else going on, they're not thriving, they're underweight, they look sick, right? So let's take a look at the whole picture for that cat. Are they social? If we have the resources to address what's going on with that cat, maybe we do put that cat on an adoption pathway. If they have really severe dental disease, but they are not thriving, again, this sort of falls under that category. And so can we address it in a timely manner? Maybe they can go back out, but if we can't, then let's take a look at that whole picture. And then amputation. So in a lot of situations, again, this is about looking at the whole picture. If this is a cat who clearly has not been using this leg for a very long time, right? This cat's doing great on 3 legs, so let's just get rid of the source of pain or infection and put that cat back out. Maybe if this is a newer injury, then socialization status matters, right? If we can, potentially we put this cat in an adoption pathway. But if that's not an option, then could we potentially release this cat or place this cat as a working cat where we can still remove that leg that's causing a problem, but put them in a safe environment. And so that might be another option for them. All right, so wrapping up. Remember, return to field is the default pathway for cats that come in as strays. And for cats that are owned that have gotten out or have accidentally gotten scooped up, this is the most likely way they'll be reunited with their people. And for true community cats, they're thriving. Let's get them back out to their community home. The saves are limited adoption outcomes for those cats that don't have return as an option. Now, so in order to make this happen, for cats with medical, our goal is to choose the treatment option that will get them back out of the shelter the fastest, and we try to return as many of them as we can. We know the longer they stay, the more likely they are to get sick and to suffer that poor mental welfare from the stress of the shelter. So the best thing, both for individual cats and the best thing for life-saving, is to get them back out to their home and their community. If you want more resources, check out network.bestfriends.org. We have tons of resources there, but including our Community Cat Handbook. And then if you need assistance from our National Shelter Medicine team, you can request help here using that QR code or email us. And if you need medical protocols, we have sample protocols in our online library that includes a return to field medical protocol and some guidelines for returning cats. So summarizes a lot of what we talked about here today.